Hi, this is Dr. Bob Dannenhoffer again. This is another one of our Facebook Live events. Today it's May 22nd, before Memorial Day, and we're going to do a Facebook Live tonight. We'll take your questions tonight, so you put them on the chat function, we'll get them. This is my balaclava, which is my face covering, but I'm going to take it down for those people who read lips. So again, I'm Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County, doing our Facebook Live. If you have questions, please put them on the chat thing and we'll get to as many of those questions as we can. In addition, I've got a bunch of stuff to talk about, some really fascinating stuff about this COVID. I'm learning so much about this. And being such a nerd, it really keeps me busy. Anyway, so as we typically do, we'll start in the world. In the world, this is still a very, very, very active virus. We're up to about 5.3 million cases. When we started doing this, we were less than a few 100,000, now 5.3 million. So this has really taken off over the last 2 months, 340,000 deaths. That would be a case fatality rate of over 6%. So case fatality means that for every case you diagnose, how many die. 6% is really high because we think that in the end, if you found every case, it should only be about 1% or so. So this suggests that with 339,000 deaths, there's maybe as many as 33 million cases in the world. That is truly a staggering number. In the U.S., we're slowed down a bit, but we're still having a big rise. Other countries are also having a big rise, especially Brazil, India, and Russia. These are three really worrisome countries. These are big, geographically big, population-wise, and important political countries, and each are having huge outbreaks. So I'm looking here at Brazil, almost 20,000 cases today, and 17,000 cases yesterday. So really a huge amount. And throughout the world, yesterday was the most number of new cases around. So for anybody who thinks this is going away, it really isn't, even as the weather is warming up. In the U.S., there's still 11 states with over 1,000 new cases a day. That's a lot of new cases. If we think about how many people that takes to track those 1,000 new cases, it's a lot of people and a lot of cases. So although things are getting better, we're clearly not out of the woods. Now, Oregon is still a little bit better. Oregon hit our peak a few weeks ago and has been steadily down. This week, we've had one of our lowest weeks ever. That's a good thing, and we'll talk a little bit about what that means with reopening. And our death rate continues to fall, and our hospitalization rate continues to fall. So that's all good news. Now, as you remember, last Friday, just around this time, we started opening up Oregon. And so, it's a week later, we haven't seen a big increase in cases, but that's not surprising. Because let's suggest that maybe on the 15th, we opened up and a bunch of people got infected. It would take 5 or 6 or 7 days for symptoms to show. So that means if they got infected exactly on that Friday, their symptoms would show up Wednesday, Thursday, or Friday. It usually takes a day or two to realize, this isn't normal. And then if you've got to test that day, another day or two for the test to come back. So we don't think we're going to start to see the impact of reopening until next Tuesday or Wednesday. But still, so far, it's great. We're still in Douglas County, still at 25 cases. No new cases, although there's a confusing thing that we'll talk about next week. But no new cases, still 23 recoveries, only 2 active cases. Still one fellow in the hospital who's quite ill, but we understand there's some progress being made there. I've got a bunch of things here that if we get a break in the questions, I'll go through, but let me take your questions. So I heard if you get the flu shot, you would test positive for COVID. Is that true? Kathy asks. That is definitely not true. While the flu shot is important and COVID is important, they're 2 totally different viruses. They don't cross-react at all on any of the tests. Now, there was a little bit of misinformation came out that people who got COVID were more likely to have gotten the flu test than people overall, and that's not surprising because seniors are the ones who usually get the flu shot, and so that they would have a higher rate of COVID. When we looked at people at a certain age, having a flu shot didn't seem to influence one way or another. One of the other things is early on that came out is BCG, which is that tuberculosis vaccine that's been around for many years. There was some suggestion that people who were inoculated with BCG had a lower rate of COVID. A very nice study done in this last week showed that was not the case. So again, another thing that doesn't seem to help. So Evelyn says, do we have a new positive today? Well, we have a confusing story today. And I don't think I can give you any more details, but we have a confusing story today that I hope by next week we're going to be able to tell you more about. But it is not a confirmed positive today. So do we know if pool tables will be open for play in phase 2? Well, pool tables in your own home are clearly open for play. Pool tables in restaurants and bars, I don't know if they're going to be open in phase 2. The problem with pool tables and ping pong tables is that people do tend to congregate around the tables, especially when I'm playing, so they can see how terrible I am. But when other people play, they congregate around the tables and drink beer or whatever. So it's thought to be somewhat of a risk, but I don't know what's going to happen in phase 2. And again, when we talk about opening in phase 2, we're talking about what's the risk of different activities. And again, when we talk about the risk, the risk is, can you avoid close social contact? So we had a party this evening to celebrate one of my dear friends who got into medical school, and we had a party outside. We all brought distancing sticks, so we all stayed 6 feet apart. It wasn't exactly like a real party, but it was pretty great. And the important thing is we were outside, which is an order of magnitude less risk than being inside. We stayed 6 feet apart during the whole time, and we still had a pretty good time. Yeah. So Lori says, how will kids ride the school bus? My goodness. And how will they safely check out library books? So one of the things that came out this week from the CDC is that they said, look, we really should have less concern about surfaces. Because when we look how cases are transmitted, we think there are very few, if any, cases where somebody puts in a library book and another person picks up the library book and gets the disease. That's a pretty hard way to get a respiratory virus. So I think the CDC has said that that's okay. Now, on the other hand, riding a school bus is a very complicated deal, right? We think to be safe, you need to have at least 35 square feet per person. Well, these school buses are usually 40 some odd feet long and 8 feet wide. So, there's 320 square feet, enough for like 1 or 2 kids in there. One kid in the back row, one kid in the 5th row, one kid in the 3rd row. I do not know how we're going to do school buses, because school buses actually are buses in general are a risk. So when the Chinese looked at the biggest risk was household. Not surprisingly, it's pretty hard to distance yourself from people in the household. Second was employment, and third was transit. And so transit is a big concern, because it's going to be really hard to separate kids, and I'm not sure how you do it if you can only put 5 or 8 kids on a bus. So Patty says, will masks be the norm from here on out? I don't know. So masks are the norm in many other countries. Masks are the norm for some people. Certainly there's some people who don't want to wear masks. Again, the most important thing is social distancing. So social distancing and staying home when you're sick are the 2 far and away most important things you could do. They are 10 times more important than anything else. Next on the list, going down, would be washing your hands, cleaning surfaces, wearing face masks. They really are about a 10-fold difference in safety. And then after that, it's stuff like asymptomatic testing and washing down roads. It makes no sense to do the little things that have a little help, like wearing masks, if people are not going to socially distance. And that's why I've been really frantic when I see these pictures of people wearing masks being really close to each other, because wearing masks help if you also socially distance, but wearing masks by themselves, will it become the norm? I don't know. Things that become the norm, what you see is they start off and then they just get more and more popular with time. I've been very carefully looking at the number of people wearing masks around. I don't think it's becoming more and more popular with time. Seems like we hit about a quarter or a third of the population, and we're kind of stuck there. It could be. I'm not sure. Now, some of wearing masks is because of the modeling we see, right? If we see me wearing a mask all the time, maybe that'll convince somebody to do it. If we see teachers wearing masks, if we see our pastors wearing masks, these are things that may encourage people to do it. We've gotten a very mixed message from our politicians, so I don't know. Today I was told that phase 2 would start on phase 2. Okay. All right, we'll do it again. So I have heard that 23 have recovered, had an antibody test. How did they come back? So the story is you do not need an antibody test to be recovered. Some of the people who were recovered had antibody tests and they were positive, as we would hope they would be. Not all had antibody tests. I'm not sure how an antibody test helps in somebody who is positive. So Kathy says, do you think our testing is finding the majority of positive cases? This is a great question that nobody exactly knows the answers to. And so the way we would know that, right, because you don't know about the asymptomatic people, but I was at a seminar the other day and it suggested that in places that had the least effective testing, they probably missed 5 cases for everyone they found. In places that had really a lot of testing, which is even a little less than ours, you probably had 1 case for every case you found. So I think we're probably in the 1 or 2 cases for every case we found. So we think there were 25 cases in the community that probably over time there have been somewhere between 50 and 75. So Dennis says, do you think extra cleaning and stronger cleanings are weakening our immune systems? So, the immune system is working all the time, and our body are just full of germs. I mean, our colon has got billions of germs in it, and most of the germs in our body, on our skin and our exhale and our nose, are good for us, and we want them there. In fact, we know if you kill off all the bacteria with like strong antibiotics or something like that, people get really sick. So we think the germs are there are good. And we do know that kids were exposed to more germs. They live on a farm and they have animals and dogs sleeping in their room and cleaning up the hay barn, do have more exposure to bacteria, and actually they are healthier. And so I am not recommending that people don't go outside. People should go outside. They should play in the woods. They should play with their animals. They're just, of all the germs, there are just a few that are really bad guys, and you have to protect yourself against the really bad guys. The really bad guys that are circulating now is the COVID, and the really best way to protect that is social distancing, staying home when you're sick, wearing a mask, washing your hands. Will it weaken our immune systems if we live in a sterile environment? Probably will, but I don't think anybody is suggesting we live in a sterile environment. Yeah, so Lee said, how severe were the cases in Douglas County? The VA nurse is intubated, is obviously critically ill. Yeah, so when you look at cases, out of 100 cases, there may be anywhere between a third or 40% that are totally asymptomatic. Another, say, a third or 40% that are mildly symptomatic. There are typically about 20% that are sick enough to be hospitalized, and of those, there's maybe a quarter or so that are ill. So if we have 25 cases that we know about, so there's probably another 25 out there that are asymptomatic that we don't know about. There's probably 20 or 25 asymptomatic cases. 25 cases that we had here. We had 5 in the hospital and 1 that was critically ill. So we're following almost exactly the distribution in the rest of the world. So 5 of the people, 5 were sick enough to be hospitalized. Only 1 is still critically ill, and we're worried about it. So Patty says, when will this year's flu vaccine come out? And I do not know the answer to that. The flu vaccines are each year made in the springtime and come out usually in September, October, although sometimes they're delayed a little bit, sometimes they're a little earlier than you'd expect. We understand this year that the flu vaccine appears to be on track. But this tells you how difficult it is to make a vaccine for the COVID. We've been making flu vaccines for 80 years now. And even with that, there's glitches in the delivery system. Sometimes it doesn't work very well. Sometimes there's parts of it recalled or whatever. And this is a vaccine that we have lots of companies making it for 80 years. This is going to be a brand new vaccine, brand new process, and that gives me a little bit of a pause when we heard that the vaccine is going to be out by the end of the year. Now, Fauci did clarify today, and he said, that is aspirational. That's my hope. It's going to be out by the end of the year, but there are so many roadblocks along the way, we can't be sure. So let me talk then a little bit about the vaccine. So Moderna is a company that did a vaccine. It did its phase 1 trials. So the phase 1 trials Very small group of people. In this study now, 45 got tested. They give them the vaccine in various doses. They look to see for side effects, and then they look to see if you developed any antibodies. And they did not have severe side effects, and they did develop antibodies. So that's a good thing. Now, we don't know if the antibodies are going to work. We don't know if they're going to prevent disease. We don't know if you studied more than 45 people, and especially people who were somewhat ill or not perfectly well, whether they would have side effects. So that's how you do it, though. You do a phase 1 study to be sure that there's not going to be severe side effects, because there would be no reason if you had severe side effects in young, healthy people to go on and give it to others. So they're going to move to the phase 2 study. The phase 2 study will have more people in it. They'll have people with a wider age and health group, and then we'll get a chance to see what happens. The big question is even though you have antibodies, does it protect you against disease? And that's the thing we don't know. Because there are a lot of disease where you get antibodies and it doesn't seem to help you, right? Like HIV, herpes, all these things where you have antibodies, but they don't seem to help you fight the disease. So we're not sure how this is going to work. Okay, so Janet says today was told that phase 2 would start on June 1st. It will not start on June 1st. In Oregon, we're going to use a minimum of 21 days in each phase, which is very, very logical. And the reason it's logical is, remember, those people, if they went out on May 15th and got it, we wouldn't find out about them, for 6 days while the disease was incubating, a few days for them to figure out they had disease, and then a few days to get the results back. So probably we're not going to find out about those till the 25th. So we wanted to be sure in Oregon that we had plenty of time to see. So the earliest we would go to phase 2 is June the 6th. Now, right now, it looks good for June the 6th, but this is such an unpredictable virus that I try not to predict in the future. So what do I suggest for child care centers? Social distancing and toddlers doesn't seem to work well together. That's exactly right. And so child care centers is a risk. Child care centers are going to try and reduce that risk with lots of cleaning. They're going to try and reduce that risk by shrinking the cohorts in there. So in the past, child care centers could have a bunch of people coming in different days. And so over a week's time, one kid could have been exposed to many, many kids. The way they're going to work it now, the kid should only be exposed to a maximum of 11 others and 1 or 2 teachers. And so we're trying to limit this. But the distancing in childcare is very hard. The alternative of not opening childcares, though, makes it really hard to reopen society. I mean, a lot of our best workers are young people who are parents, and these young people who are parents frequently will need childcare. So we'll see. Now, I will tell you that during the lockdown, emergency childcare was open, and there were no outbreaks among emergency childcare. So this is going to be certainly something to watch, because if we can't open up childcare centers, that's going to be really hard. Yeah, Julie says, do I have any suggestions or predictions for how choir and band practice could look in the fall? Well, this is a concern, and is especially a concern because there was a report in the Morbidity and Mortality Weekly Review, the Journal for Nerds, that talks about different diseases, and they do these disease outbreak things. And one of them was this choir in Skagit Valley up in Washington, where one person who was sick went to choir practice and infected a bunch of others, and 2 died. And so the real risk is when you sing, you're expelling lots of droplets, you're close to each other, you're listening carefully to each other, you're typically there for a long period of time. So I do not know how choir is going to work. Band could work outside. Again, one of the things that the CDC came out with this week, and you've heard here before, is that outdoor transmission is much, 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 much less likely than indoor transmission. So I think a band marching on the field, I think it'd be pretty safe. I think a choir practicing in a classroom, a lot more risky. But I think band could look like that, and maybe we'll do outdoor choirs. I don't know how that's going to work. So what are churches allowed to do? Joanne asks. Yeah, this got really politicized today, and I'll stay away from the politics. churches are a concern, right? Because churches are concerned because typically we try in churches to be close to people. I mean, that's a lot of what church is about, being there with friends and family and hugging people you haven't seen before and commenting on how old Aunt Sally is doing and all those kinds of things that you do where you're relatively close together. There tends to be singing and chanting in churches that expels more droplets. And we tend to be there for a long period of time. It's not something you're there for 3 minutes for. It typically, people may be there for an hour or more. And so for all of those reasons, churches are high-risk settings. And when we look at super spreader events, that is events where a bunch of people got infected at once, churches are way places of worship. Not just churches, but synagogues, mosques, and churches are way overrepresented. And that's because it's a big group of people, relatively close for a long period of time, doing forceful talking and singing. Churches are allowed, like anybody else, to be open for gatherings of 25 with social distancing of 6 feet. And so we think there are a lot of places that can do that. There are a lot of services online. We think people can do that. We still haven't exactly figured it out about outdoor services, but I think churches, there's no special prohibition on churches. I just think we have to recognize that church is a relatively high-risk adventure, just like choir practice is a relatively high-risk adventure. So Veronica asks, what do you suggest we do about a restaurant where the servers are not wearing masks? And again, public health doesn't have any mask police or social distancing police. We give recommendations and hope that people follow them. Restaurants are workplaces and they are subject to OSHA, and OSHA will talk with places and do that. But again, remember, staying home when you're sick and social distancing, so much more important. Unless you do that right, let's not worry about all the other crap beneath it. Really important is social distancing and staying home when you're sick. And once we've mastered that, then wearing masks and some of the other things like disposable menus and whatever may make sense. But you could call OSHA. OSHA is talking to people. We talked with somebody today who talked with OSHA, and they ironed out a problem. And in the end, everybody was reasonable, and I think it's going to be great. So Ashley says, is singing worse than coughing? Great question. We don't know, but singing is pretty bad. So Florida International University did they stole my Mythbusters thing, and they did this using really sophisticated lasers and whatever else. And they show with breathing, talking, loud talking, singing, and coughing and sneezing, how things went. Sneezing is worse, coughing next worst, but singing was remarkably good at making droplets. And I guess that's not surprising. I mean, these people who sing have these phenomenal breath capacities. I mean, I cannot believe how long they can sing or how long they can hold a note, suggesting that they're so good at controlling their voice. So when they're singing loud, it's not surprising that there would be a lot of droplets. But singing is so great in life that... So Marlene says, what do you think about camping with my grandchildren? Well, so again, remember, we're talking about outside is better than inside. Presumably we'll be camping outside. That's a good thing. So that's better than, for example, them coming to stay overnight at your house. Again, with grandchildren, the more people you bring into your group of close contacts, the more likely the risk is. And I've had a couple of heartbreaking conversations this week with different families, where there's somebody in the family who's deteriorating and somebody in the family that's dying, and somebody wants to come visit and they want to know what the relative risks are. And I don't think anybody can say definitely do it or definitely not. If you're with your grandchildren on a daily basis, camping with them is perfectly fine. If you don't see your grandchildren on a regular basis and now you see them, there's a risk that one of them will have it and they'll give it to you, or there's a risk that you have it and you'll give it to them. And so you have to weigh that risk. Now, would I recommend you go camping with 500 of your closest friends? No. But camping with your grandchildren is one of those intermediate activities where people have to decide for themselves what kind of risk they want to take. So talking about children, two things that came up. One, now that there are more cases overall, there are more cases in kids. So you remember back when we started, and this was just in China, we said, well, the Chinese experience has been that there haven't been a lot of problems in kids. There had been no deaths and just a few ICU admissions. And the moms who were pregnant with this did reasonably well. But that was when we had 80,000 cases. We have 5 million cases now, so we have a lot more experience with this. And as we have more experience, we're starting to see some kids with this who get quite sick, who wind up in the ICU, some deaths among kids, and especially some deaths among infants born to moms who were COVID positive. So in the past, when we said the risk appears to be low, the risk is still low, but it's certainly not zero. And the recommendation now is that babies who are born to COVID positive moms get tested and carefully monitored. The other thing is this multisystem inflammatory disease. Again, we hadn't seen that back in the Chinese data, but again, it's one of those kind of things that it appears that it takes about every 20,000 cases you have in adults, you have one of these multisystem inflammatory diseases in kids. So, it wouldn't be shocking that they didn't see much of this in China, or if they saw it, maybe they didn't recognize what it was. But now that we have lots of cases in Italy, lots of cases in the UK, lots of cases in the US, we're seeing more and more of this. And this does appear to be pretty serious. We're also seeing that some young adults, people in their 20s, are also starting to get it. And again, this is not surprising. This had been a disease of children, but you'd see the occasional teenager, so that we see now the occasional 20-year-old is not shocking. So do I think any of the swimming pools will be open later this summer? And I think they will. Swimming pools were not in phase 1, but I'm pretty sure they're going to be, at least some of it is going to be in phase 2. When you think about it, swimming pools, outdoor swimming pools are outdoors, remember, lower risk. Swimming pools are full of chlorine, something that kills coronavirus. And you can sometimes enforce social distancing in a pool, 1 per lap, family groups in one area at one time. So I think they will be, but I've not seen the rules yet. Now, one of the other things that I wanted to talk about today was about chloroquine. Well, we've heard so much about that. So chloroquine is still very controversial. Large European study came out today that showed an increased death rate in people who took it from heart side effects, mostly from ventricular arrhythmias. We're not surprising because we've known that high-dose chloroquine can indeed cause arrhythmias, and that's why people have been cautious about using it. The difference was enormous, though, that the rate of ventricular arrhythmias, which means that your heart is beating totally wrong, was only less than 1% of the people not using it, and 8% of the people who were using it. And actually more people in the chloroquine arm died. Now, these were people who were already pretty sick. The studies that are now happening is whether chloroquine would help as a preventive. There's no data on that. Remdesivir, which is the antiviral agent, is out. I think the data shows that it might help decrease length of stay. I don't think there's any good data that it has a remarkable impact on death rates. But again, decreased length of stay is a good thing. Oregon got their delivery of remdesivir, so if there's somebody in Oregon that needs it, they can get it. So Penny says, what does the next phase look like? Well, I think the next phase looks like this phase, but a little bit more. I think maybe there'll be a deal about more outdoor gatherings. I think you'll be allowed to have some pools open. I think you'll be allowed to have some other kinds of gatherings that would happen. I think maybe the size of gatherings will go up a bit. So I think it's going to be a cautious step along the way. It is a long, long time until we're back to, let's just do things the way we used to. But I think the next phase is going to be an opening. Yeah. So Janet says, well, if soap and water fights germs, why are gyms not allowed to open showers? I believe the reason on showers and locker rooms is that there's just natural crowding in locker rooms. I mean, I go to when the Y was open, I would go almost every day, and I would swear that there would always be somebody in the locker right next to mine when I got out. And so you were close, and you're close for a while. As you were doing things, you might be there for 10 or 15 minutes, which would be a worrisome thing. So I think the idea that people come in already dressed, do their thing, leave without taking a shower, is in phase 1. In phase 2, that could change. And said, can you get COVID in your eyes and transmit it from eye exposure? So yes, we think so. Actually, we think that the eyes are a pretty good way to pick up germs. Again, viruses don't live on their own. So viruses live once they go into a cell and then start to replicate in a cell. And so viruses typically need sort of a moist surface for them to move around. And so, viruses that just hit your skin, pretty unlikely to get infected, but if they hit your mouth, your nose, or your eyes, they can be in that liquid that's there and move around. So we do think actually some transmission in the eyes does happen. There are other diseases where it's a lot clearer that the eyes are the portal for many of these infections. Can I speak to long-term damage if you survive COVID? I was at another seminar this week that talked about long-term damage from COVID. These were pulmonologists, so they presumably see the worst of the worst, and they were talking about people who had really nasty-looking lungs and really decreased lung function 2 months after illness. Now, again, in the U.S., we don't have that many people who are more than 2 months. This was a little concerning about long-term lung damage. So I recently heard that COVID isn't as serious in kids with asthma as it is for other underlying conditions. So asthma is an interesting one with this, right? You would think, asthma is a common respiratory illness, and you think that it would be one of those risk factors. But if you look in the New York studies, if you look at the Oregon studies, asthma is not prominent on the list of severe underlying conditions. And it may be because this disease is in the lower parts of the lungs where the ACE2 receptors are, whereas asthma is higher in the lungs and the bronchi and the bronchial things. I don't know about in kids, but certainly in adults, asthma does not seem to be a really prominent risk factor. Again, the biggest prominent risk factors appear to be cardiovascular disease, diabetes, obesity, hypertension, neurologic disease, cancer, and other immune conditions. Okay, a couple of other things. So we have heard all along that people want to get tested, and for whatever reason, they can't. And they can't get tested either because they can't get a doctor who'll order the test, or because they don't have a doctor. And we've been trying to work through that, and I think we have a solution now. We work with the people at Aviva, and if you will call to them, we'll write this number, 541-459-3788. They'll do a quick registration process. They'll send a slip there, and then you can come through one of our Tuesday or Friday testing clinics. The reason we've been reluctant to do this in the past, we want to be sure there'll be somebody to help you if you had a positive test, and the people at Aviva have agreed to do that. So again, the number 541-459-3788. I know it works because a friend has a friend, and they've been trying to get him tested with lots of frustration along the way. And he called us this morning at like 10 o'clock, and by 1:45 he had his test done. So I think it does work. Oh, Sorrento. Yeah. Ryan says, and I did look this up. So in this last week, there was a lot of breathless news, and Sorrento was one of them. So Sorrento is this group that works on mostly cancer things. And so, cancer is this funny deal where there's antibodies out there, but they don't seem to work, and sometimes then they do. And so there's a lot of stuff about cancer genetics that's going on, which is truly fascinating. And cancer genetics may actually be the answer to cancer. Because the way we treat cancer now is you have a cancer, they give you this really, really toxic thing and hope to kill all the cancer cells, and then take away the toxic stuff and hope that your normal cells come back, but your cancer cells don't. It's sort of like if you had weeds in the lawn of just blowtorching the whole thing, hoping the weeds would go away and the normal grass would grow back. So it's really fairly crude approach with chemotherapy, and chemotherapy has so many side effects because it kills off all the normal things. So people have a lot of nausea, a lot of diarrhea, a lot of skin problems, lose their hair. And so what the antibody stuff says is, how about if we could find the specific thing that would specifically attack the specific thing that was doing it? So imagine now if you had the specific antibody that you could spray on the lawn and it only worked on dandelions, that then could be very effective in doing it. So there's a lot of cancer genomics going on. So Sorrento has this big thing of antibody stuff, and they say that they found a specific antibody that neutralizes the spike protein, and that you could make a monoclonal antibody now that could fight this disease. And that is one of the things we have talked about now for about a month. So monoclonal antibody is you find an antibody to something, and then you produce this in the laboratory, and then you give it to people to help prevent a certain disease. Now, there's lots of these monoclonal antibodies out there. Most are monoclonal antibodies that like Humira and stuff like that are mostly antibody-based stuff. So we know how to do that stuff. It's doable. And actually this would be, when I look at all the different ways that we could be over this, there's a lot of focus on vaccine, but we'll talk a little later about vaccines. I'm not sure that's the way it's going to work. Monoclonal antibody could work, right? So monoclonal antibody you could have it there, and then you give it to high-risk people. That could work. You could have a really effective treatment. So imagine if they said, oh, you got COVID, take this kind of remdesivir that really works, and you'll be a little sick, but you won't die. Or you could have a preventive medicine that you might take every day to prevent you from getting it, like we do chloroquine for malaria. So actually it does work for malaria. So chloroquine that you use for malaria to prevent it. So these are all things that are possibilities, as well as a vaccine. So this from Sorrento is very interesting. They did this right at the time they're trying to raise money. And so, when they say it's going to be 100% effective, I took that with a grain of salt. So can you make a monoclonal? Ryan says, can you make a monoclonal polyclonal antibody? You can. Almost all of these monoclonal antibodies work, which means that it's one antibody against one thing. And in this case, it would presumably be the spike protein. So imagine if you could make a monoclonal antibody against spike protein and inject it in people once a month or whatever. And so you had this antibody circulating in your system, and that when your body started to see the COVID germ, it did that. I don't know. The only other monoclonal antibody that we use, I think, of polyvimazab, say that twice, that protects against a pediatric disease is only mildly effective. So I don't know. So someone says, I have 3 family members that have tested positive for COVID antibodies. Are they added to our state total? If they live in Douglas County or in the state, yes, they would be added. If they got the test at a place that reports results. So, we've talked for 8 weeks now about antibody tests. Antibody tests are a total mess. In fact, the FDA came out today and said 28 of these antibody tests are so unreliable that they can no longer be sold. So a lot of people who had those antibody tests, I don't know what you do with those people that had such unreliable results that these things can't be sold anymore. So again, on these antibody tests, I don't know where they were done or how they were done. If you could send us, whoever sent this question, if you could send us a private note, we'll find out about that. So antibody tests are done in Oregon. We collect all those antibody tests. We know about them. But a positive antibody test, because of all the problems with it, have not been counted as positive cases. That's controversial. The concern is, if you just added all those as positive cases, the case count in the U.S. would tremendously increase, and there's some pressure at different levels to keep the case count in the U.S. down. So if we did that, the case count might go up, and so I don't think we're going to do that. But in Oregon, we carefully follow all the positives and negatives. We have just 5 positive antibody tests now, none of which are a great surprise. A couple of other things that I have here. People always wondered why kids are less sick with this than adults. And apparently one of the theories that comes out now is that the ACE2 binding site, which is where the spike protein binds, is much less prevalent in kids than it is in adults. So as we get older, we develop more and more of this binding site. And the thought is that the binding site is really not very common in kids, especially in their upper tracts. And because it's not very common in their upper tracts, it's a lot harder to be infected. That would kind of make sense. It'll be interesting to see if people can replicate that. The other thing is the CDC came out today and said, I think we have to be less concerned about surfaces. I think this is not surprising. None of us thought that the COVID on the floors or in your shoes was a big risk. But what they did say was that the risk of close gatherings is a real risk, especially things like buses, especially things like choir practices, and less concerned about outdoors. Okay, what's going on with the Providence serology study? They sent it back once, right? So I did get a sneak preview of this study this week, and I can't tell you all the details, but I think it is what I can tell you is consistent with the other places that the rate of antibodies is low. So anybody who's thinking, well, this is blown through, most of us are now immune, totally not true. Less than a few percent in most places in the state. In Southern Oregon, even lower than that. A local clinic did it with their people, and it was 0. So there's not much antibody level in Douglas County. So going along with our thought that we've not seen very much disease. The other thing that has been noticed in places is that these antibodies don't seem to last very long. So unlike something like measles, you get it once, your measles antibody is there forever, even if you never get tested again, even if you never get challenged again with measles. This one, unfortunately, what it shows is that the antibody go down fairly quickly. So in one study, similar to what happened in these other ones, is that people who are positive, you test them a few weeks later, they can become negative, suggesting that the antibodies are not long lasting. So that's a concern. And then the further concern is if the antibodies are not long lasting, are they at least protective? And we don't know. Again, when we talked about the Teddy Roosevelt, that aircraft carrier, now it's 14, I hear, that have tested positive for COVID after their symptoms were gone. They tested negative. They were totally asymptomatic. They returned to duty. They got sick again, and they tested positive. So that would be a concern that you don't have much immunity to this disease. And that would make the development of a vaccine very much harder. Because again, imagine if you give a vaccine, get a good level of antibodies, but a few weeks later the antibodies have dwindled, then that's not going to help you very much to prevent disease. Okay, so this new way to get tested. Again, the best way to do it is to call your doctor, get an order, and we'll do it. However, if you don't have a doctor, you should really get one. But if you can't get one right off, or you somehow can't get the order, call to 541-459-3788 and be clear to ask them for it. They are going to ask you some questions because Aviva is a federal qualified health center. They do need to collect some information. So they will collect some information, but they'll say yes, and then you'll get a test. And again, that should work out pretty quickly. We did another 20 some odd people this afternoon. We're going to do some tomorrow in Reedsport. Now, at this point, many of the ones we're doing are for people who are having surgeries and they want to have preoperative studies. That's probably not an unreasonable thing. And then I was talking to somebody from a cancer center in Eugene. And again, the cancer docs would like people to be negative before they give them cytotoxic drugs. Again, that's not unreasonable either. So in the testing, we can also do that. So Carla says, would you advise someone who had symptoms in February to have an antibody test? Sure. And to see if what you had truly was COVID or not. Again, for the most part, all of these people who swear they had the disease in February and March, when they've had antibody tests, they've been negative. But, the only way you know on these things is to get it done. If you are going to have an antibody test, what I would recommend is that you have a laboratory test done at a true lab where they actually draw blood from your arm. They send it off to the lab. Those tests seem to be quite accurate. The ones done at LabCorp, Quest, Mayo Clinic, and whatever appear to be quite good. It's the little ones that look like the pregnancy tests that got recalled today. Yeah, Deborah says, do you know why Deschutes County has such a high number of cases? Actually, I don't know, but boy, they've really had a bundle this week. I don't know the specifics over there. What we have seen is that it happens to be in people who are traveling. And Bend has got a population that may travel a little bit more than others, but I don't know the specifics. Again, Douglas County, we're doing pretty good. Okay, we're going to do just a short one on Monday for Facebook Live here. It is a holiday, so I'm encouraging people this weekend to go out, have a great time, enjoy the sunshine. We think sunshine is great. When you're out 6 feet away from people, you do not need to be wearing a mask. When you're around family members, you do not need to be wearing a mask. Go out, enjoy the world. What we don't want people to do is to travel hundreds of miles so that you have to stop for gas and food and whatever along the way. We would like people not to do dangerous things, because if we do dangerous things, then the EMTs need to come rescue us, and we don't want that to happen, because when they do that, we put them at risk. And we don't want people to, we want people to be very careful in the river. The river is great, but it's pretty darn cold. So be careful there. Again, we're doing great here in Douglas County. I thank everybody again and again for the great work that people have been doing with social distancing, using masks, and in general being kind to each other. So thank you for that, and we'll see you again on Monday. Thanks again. This is Dr. Bob Dannenhoffer, Public Health Officer from Douglas County.